Hello everyone. Today I will give you a brief explanation of female reproductive system. Hope you understand very well. Reproductive system ensures the continuation of species. Normally, most of the animals including humans are either definite males or definite females. The female reproductive system is a set of organs present on the human beings, identified as female. These organs are concerned with the process of reproduction and produce the egg cells or ova. Necessary for reproduction, secretes female sex hormones and produce milk to nourish the newborn. The female reproductive system consists of internal organs. Number 1. Ovaries. Number 2. Oviducts or uterine or fallopian tubes. Number 3. Uterus. Number 4. Vagina. And then external organs. Number 1. Mons pubis. Number 2. Clitoris. Number 3. Labia minora. Number 4. Labia majora. Number 5. Vestibule of vagina. Number 6. Bulb of vestibule. Number 7. Greater vestibular glands or Bartholin's glands. And finally breasts or mammary glands. Here I show you the lateral cross-sectional view of female reproductive organs. Posterior view of female reproductive organs. Now I explain about ovary. The paired ovaries are the female gonads, storehouse of female gametes or ova, homologous to testes. It produces and releases eggs or ova. Each ovary is oval in shape, 3 cm long, 1.5 cm wide, 1 cm in thickness, situated on the lateral wall of the pelvis. Each ovary is attached to the upper part of the uterus by the ovarian ligament and to the back of the broad ligament by a broad band of tissue, known as mesovarium. Blood vessels and nerves pass to the ovary through the mesovarium. Ovary secretes estrogen and progesterone hormones, which is under control of pituitary gonadotropin, FSH and LH. Structure of ovary. Germinal epithelium. It covers the surface of the ovary and it continues with the mesothelium that covers the mesovarium. Tunica albuginea. It is a whitish capsule of dense irregular connective tissue extended deep to germinal epithelium. Here I show you the cross-sectional view of structure of ovary. Cortex. Outer part of ovary. Made up of stroma and ovarian follicles. Stroma. Consists of reticular fibers and fibroblasts. Ovarian follicle. It is lie in the cortex region of stroma. Here the oocytes pass from the various steps of their development with their surrounding cells and produce follicular cells and secrete estrogen. When estrogen level attains a peak, it leads to stimulation of luteinizing hormone surge and rupture of Graafian follicle on the 14th day of cycle, and the mature ovum is released near the open end of fallopian tube. This process is called ovulation. The ruptured follicle is known as corpus luteum. Medulla, inner part of ovary, made up of connective tissue and has a rich network of blood vessels and elastic fibers. Blood supply to the ovary. 1. Ovarian arteries branch of abdominal aorta. 2. Ovarian vein to the inferior vena cava on the right and renal vein on the left. Nerve supply. 1. Sympathetic fibers from spinal segments. 2. Parasympathetic from vagus. Here I show you blood supply to the female reproductive organs. Now I explain about fallopian tubes or uterine. 2 fallopian tubes are the site for receiving the ovum from ovary. It stretches from the uterus to the ovaries and measures about 10 to 12 centimeters long. It transports the oocytes or eggs from the ovaries to the site of fertilization ampulla and carries sperm from the uterus. Parts of fallopian tubes. 1. Infundibulum. The open, funnel-shaped portion of each tube is known as infundibulum, close to the ovary. 2. Fimbriae. At the end portion of the infundibulum has finger-like projections known as fimbriae, which hold the ovary. 3. Ampulla. Widest and longest portion of the uterine tube is known as ampulla. 4. Isthmus. Short, narrow, thick-walled portion known as isthmus that joins the uterus. Now I explain about uterus. The uterus is a thick-walled, pear-shaped, hollow muscular organ, situated in the pelvic cavity, with the urinary bladder in front and the rectum behind. The uterus is about 7 to 8 centimeters long, 5 to 7 centimeters wide and 2 to 3 centimeters thick, and weighs 30 to 40 grams for a non-pregnant adult. Parts of uterus. Fundus, the dome-shaped portion superior to the uterine tube known as fundus. Body, the major tapering central portion is known as body. Cervix, the inferior narrow portion opens into the vagina known as cervix. Layers of uterus. Perimetrium, outer serous coat. Myometrium, middle, muscular coat, 12 to 15 millimeters thick, consists of smooth muscle fibers, blood vessels and nerves. During pregnancy, the thickness increases greatly. Endometrium, inner mucous coat, the thickness varies according to the phases of the menstrual cycle. It is thin at postmenstrual phase and thickest at the end of secretory phase. Under proper hormonal stimulation, the endometrial wall gets modified for the implantation of the fertilized ovum. After puberty, the uterus undergoes cyclical changes known as menstrual cycle. These changes prepare the uterus to receive fertilized ovum and nourishes the embryo and maintain pregnancy till birth of the baby. Blood supply to the uterus. 1. Uterine arteries, branch of internal iliac artery. 2. Ovarian arteries. 3. Uterine veins. Nerve supply. 1. Sympathetic. 2. Parasympathetic nerves from the inferior hypogastric plexuses. Now I explain about vagina. The vagina is an elastic, fibromuscular canal that connects the cervix of the uterus to the exterior of the body, vulva, anterior wall 8 cm and posterior wall 10 cm long. It is the female copulatory organ, lies between the urethra and bladder, in front and the rectum and anal canal, behind. The vagina is directed upwards and backwards from the vulva making an angle of 45 degrees with the uterus. Structure of the vagina. It has 3 layers. 1. An outer covering of smooth muscle. 2. A middle layer of connective tissues. 3. An inner lining of stratified squamous epithelium cells that forms ridges or regae and can stretch considerably to receive the penis during sexual intercourse and allow for birth of a fetus. Point to be noted. It has no secretory glands but the surface is kept moist by cervical secretions. Hymen at the end of vagina. There is vaginal orifice covered by the mucosal membrane known as hymen. Sometimes the hymen completely covers the orifice, a condition known as imperforate hymen, which may require surgery to open the orifice and permit the discharge of the menstrual flow. The vagina function as 1. The receptacle for the penis during sexual intercourse coitus, and carries sperm to the uterus and fallopian tubes. 2. Birth of baby. 3. During menstruation, flow of menstrual blood to exit the body. Blood supply to the vagina. 1. Vaginal artery, branch of internal iliac artery. 2. Uterine artery, vaginal branch. 3. Middle rectal artery. 4. Internal iliac veins. 5. Internal pudendal veins. Nerve supply. 1. Sympathetic. 2. Parasympathetic nerves. 3. Pudendal nerve. Let's come to external organs. Vulva. It is the collective name for the female external genital organs located in the pubic region of the body, consist of 1. Mons pubis. It is a rounded fatty, adipose tissue elevation, situated anterior to the pubic symphysis, known as mons pubis. It becomes covered with coarse pubic hairs during puberty. 2. Labia majora. The outer lip-like structure. Posteriorly from the mons pubis, to symmetrical folds of skin known as labia majora. It meets anteriorly at the anterior labial commissure, posteriorly not meet. It is covered by the pubic hair and protects the urethral and vaginal openings. 3. Labia minora. Thin, fat-free, smaller folds, hairless skin, located between the labia majora is called labia minora. It meets just superior to the clitoris to form a fold of skin called the prepuce. Posteriorly, they unite, form frenulum of labia minora, which is frequently torn during childbirth. They have many sensory nerve endings and made up of erectile connective tissue that darkens and swells during sexual arousal, tightens during intercourse. 4. Clitoris. It is a highly sensitive erectile organ, 2 to 3 centimeters long, cylindrical mass, located on the superior end of the labia minora, under prepuce, known as the clitoris. It contains many sensitive nerve endings, blood vessels and homologous with the penis in males. Becomes engorged with blood during sexual stimulation. Key to sexual pleasure or excitement for most women. 5. Vestibule. The space between the labia minora is known as the vestibule. The urethra, vagina and the ducts of the greater vestibular glands open into the vestibule. The bulb of the vestibules consist of two elongated masses of erectile tissue. During the sexual intercourse, it narrows the vaginal orifice and places pressure on the penis. 6. Greater vestibular glands or Bartholin's glands located on each side of the vestibule of the vagina, partly covered by the bulbs of the vestibule. They secrete small amounts of lubricating mucus during sexual arousal. Nerve supply to the vulva. 1. Elionguinal nerve. 2. Genitofemoral nerve. 3. Perineal nerve. Blood supply to the vulva. 1. External and internal pudendal arteries. 2. Internal pudendal veins. And finally, breasts or mammary glands. The breasts are accessory glands of the female reproductive system. The breasts are made of specialized tissue, glandular tissue as well as fatty tissue, of the female body that produces milk. It is present bilateral in the pectoral or thoracic region. After puberty, the female breasts are well developed. The female breast consists of base. Circular, vertically, extends from the 2nd to 6th ribs, in the midclavicular line, and horizontally, extends from the lateral border of sternum to the midaxillary line. Attach on the pectoralis major muscle and the pectoral fascia. Nipple. In the center of each breast is a highly pigmented nipple that releases milk when stimulated. Areola, a thickened, pigmented circular area of the skin around the base of the nipple, protects the underlying tissues during breastfeeding. Outer margin of the areola has modified sebaceous glands. Here is the picture of breasts or mammary glands. Structure of the breasts. The breasts are made up mainly, 1. Glandular tissue. 2. Fibrous tissue. 3. Variable amount of fat. The glandular tissue of each is divided into 15 to 20 mammary lobes containing clusters of cells called alveoli. The alveoli open into mammary tubules. The tubules of each lobe join to form a mammary duct. Ducts join to form a wider mammary ampulla which is connected to lactiferous duct through which milk is sucked out. Point to be noted. Milk secretion is stimulated by the hormone prolactin as well as with the contribution of estrogen and progesterone. Blood supply to the breasts. 1. Axillary artery, lateral mammary branches. 2. Axillary veins, internal thoracic and intercostal veins. Nerve supply. 1. Intercostal nerves supply the skin. 2. Sympathetic fibers supply the blood vessels. Here is the picture of blood supply and lymph nodes of breasts. If you have any query or suggestion, please text on the comment box. My next presentation will be the female reproductive system with brief discussion of physiological parts very soon.